symptoms for 2011. The problem with flu symptoms that a lot of people aren't telling you about is, one, even if you know the symptoms, you may not be able to fully diagnose that you have the flu, a cold, a rhinovirus, something worse, influenza, avian flu, swine flu, etc. The other issue with symptoms of what's commonly known as the flu is the timing. So that relates both to your care. So if you suspect that you have symptoms and you're seeing some of the symptoms that I'm about to talk to you about, a lot of times it's too late. It's like 3 days, 4 days, 5 days may have passed, and you've missed that prime window where it's most accurate to diagnose if you have an actual viral infection. Because of the life of the period where you're most contagious, and the tests that are available through your licensed practitioner, whoever that may be, either if it's Western medicine, conventional, or holistic, the whole gambit, all of those tests relate to the timing of you getting sick. And a lot of people don't realize that the trick with flus and colds and influenza is to perfectly time the test with you first becoming sick, but often it's too late and you miss that magic window. So the common flu, cold, and influenza symptoms often are, and these are all CDC approved, which is the Center for Disease Control and Prevention. Having headaches more frequently than normally. So if you normally have headaches and you have a lot of stress that causes headaches, or you drink a lot of coffee and so forth, what's normal is going to be different for you than it is for somebody else. But increased headaches, a runny, stuffy nose, having fatigue and exhaustion, running a fever, oftentimes much higher than normal. So a fever is anything past your body temperature, but if it is in the hundreds, it tells you that your body's sick. Having a sore throat, coughing or a cough, body aches and pains, diarrhea, and vomiting. You also notice that there's an asterisk at diarrhea and vomiting here on this slide. Diarrhea and the symptom of vomiting is more frequent in non-adults, so adolescents and babies and kids. When they get sick with the cold, flu, or influenza, they often display diarrhea and vomiting more so than adults. And the reasons, there's a number of reasons to that, which my website goes into, but so to make note of. So what do you do if you suspect any or all of the above? One, if you are in the high-risk zone, don't wait to see your doctor. High risk is anybody above the age of 60 is more vulnerable. If you have any chronic medical illness, such as diabetes or asthma, anything that's respiratory, if you've had, issues with your lungs in the past, anything like that puts you at a higher risk, and you don't want to screw around with this kind of stuff, and you need to go out and see your doctor. Even even if you suspect it might just be a common cold, common colds can lead, if you are in high risk already, common colds can lead to a much more heightened state. That said, side on caution and see your doctor anyways. It might be a bit of a pain in the butt to do. You don't want to always cry wolf, but depending on a number of factors here, your age, your gender, your medical history, your parents' medical history, where you live, geographic location, there's all kinds of factors that go into this, and giving you a blanket diagnosis of which I cannot, because I am not a licensed physician and this is not medical advice. It's best to err on caution and see your doctor if you feel anything's out of place. If how you feel is a little bit different, or you suspect it might be something, go